Hi, so I'm going to talk to you about something that you are experiencing that I want you to understand better. The symptoms that you are currently having are happening because the vitreous gel in your eye is separating from the retina in the back of your eye. So the vitreous gel fills this space and the retina is this orangey thing in the back. And in you, the vitreous gel is separating from the back. This happens to everybody in both of their eyes eventually, so it's not at all rare. And we see several people a day who have this condition. The vitreous gel that fills most of the eye and fits up against the back of the eye, which is called the retina. And the vitreous is actually attached to the retina in many places, and it is also attached to the blood vessels in many places. When you are born, this vitreous gel is thick, like jello. And as you get older, it becomes more and more like water. Eventually, the vitreous starts to separate from the retina. When this happens, the vitreous pulls off small pieces from the back, where the retina is, and these small pieces enter the gel, which is otherwise clear. When the floating pieces that are now in the vitreous are hit by light on their front side, they make a shadow on the back side, and the shadow is what you see as you move your eye back and forth, and the pieces float in the vitreous gel. In fact, we call those pieces floaters because you see them floating in the gel. These little floaters can be different shaped. They can be little circles or dots or lines or squiggles. It doesn't make a difference. It just depends on the shape of the crumb that's in your eye. And the floaters themselves, even they may be a nuisance to you, are not dangerous by themselves. Because the vitreous is attached to the retina, when it pulls off of the retina, it usually causes sparks or flashes, because if you pull on the retina, it makes the retina spark. These flashes by themselves are not dangerous to the eye, but they can be a sign of a retinal tear. You cannot tell if the new sparks and flashes that you're experiencing are from a retinal tear or from a vitreous separation. You can't tell looking out of your eye, and the only way to tell for sure is to have a dilated eye examination like you just had done. Since the vitreous is attached to the wall of some of the blood vessels, when the vitreous comes off the back, sometimes it will tear open a blood vessel and cause some bleeding into this gel. The blood that enters the vitreous cavity usually clears slowly, and that usually means over the course of weeks to months. The circulation is not very fast there. The bleeding by itself is not dangerous, but sometimes the bleeding can be an indication that the retina is torn. If the vitreous separation produces a torn retina, this is something that we always treat with a laser, because a retinal tear is the main reason why people get a retinal detachment after a vitreous separation. A retinal tear almost always makes new floaters, but it often also creates these flashes and sparks in your eye. If the tear is sticking up into the vitreous gel, when you move your eye back and forth, it pulls on that tear, and that lets fluid underneath the tear. And when the fluid gets underneath the tear, it lifts the retina up and makes like a blister, and we call that elevated retina with fluid under it a retinal detachment. A retinal detachment, if it is not treated, can cause permanent blindness, but it is not hard at all to fix a retinal tear. We do that right here in the office. It takes a handful of minutes. If the retina actually does detach, that can be fixed as well, but it's more involved and you have to go to St. Louis to see a retinal specialist. If you ever develop a retinal tear and the retina begins to detach, it will not hurt. There's no pain with a retinal tear or a retinal detachment, so to wait for that to happen is not realistic. However, the detached retina does not see properly. So if a patient begins to experience this blister or this separation of the retina from the back of the eye, they will usually see a curtain of darkness or blurriness come over their eye. So as you look out, this can come down from the top, it can come in from the side, it can come up from the bottom. It doesn't make a difference which direction it comes from. You shouldn't see a curtain of darkness or blurriness out of your eye. And if you do seem to have one of these, you want to come in right away so we can take a look. Almost everybody who experiences a vitreous separation has no problems and doesn't need any treatment at all. It is common that the new floaters that they see will persist in some fashion, and the floaters that you get may change as well. Sometimes the floaters will break up into smaller pieces. Sometimes the floaters will drift out of the line of sight. And sometimes you just get used to them because they're in the line of sight and you see them all the time. They are not dangerous to have. The floaters don't harm your eye, and the floaters don't reduce your sharpness of vision, like your 20/20 vision. The flashes, however, that you see when you have a vitreous separation will stop in most people, because as soon as the vitreous comes off the retina, it's no longer tugging on it, and so there's no more tugging on the retina, so it stops sparking. That's one of the ways actually that we know that the vitreous separation is complete, because the vitreous is no longer causing those sparks or flashes. Once a vitreous separation begins, it takes usually most people about a month for the vitreous to come all the way off the back. Sometimes people will have persistent flashes. They'll come back for another month or two until the flashing stops. But for most people, it's about 1 month. Let me know if you have any other questions. Thank you very much.